I've seen huge changes in the quality of life of our patients.
Not only does this device and therapy restore new life to the patient, but it gives a second life to the caregiver.
It's like, wow, they saved my life.
What we do in the Advanced Heart Failure Center is there is an option for continuing medical treatment for your heart failure, and then there are surgical options, LVAD and heart transplant. LVAD is a left ventricular assist device, which is a heart pump that will provide assistance to your failing heart.
I think we've been able to help a lot of people who've had heart failure in Atlanta and the state of Georgia by offering them these pumps.
Mr. Golden, let's go ahead and get your weight.
Okay.
The pumps themselves really do reverse heart failure. These patients go from being totally incapacitated, and not only does it incapacitate them, but it incapacitates their caregivers as well. What the pump itself does is increase the blood flow to your pre-state before you were in heart failure. So it allows you to go from just sitting in bed and walking around your house to going outside, playing sports, going fishing, doing really whatever you'd like to do aside from getting in water, swimming or scuba diving. There are different groups of patients who can have an LVAD, and then there are different groups of disease states that get LVADs. The groups of patients are the patients who are able to be transplanted, and those we call bridge to transplantation patients. And then there's the second group where the patients have gone beyond or have another medical condition that make them not a candidate for transplant, but yet we can still put these pumps in for long-term therapy, what's called destination therapy.
Hey, Mr. Duncan. Good, how are you? You too.
Now, as far as the patients themselves, there are a group of patients who have multiple heart attacks, and this affects how their heart pumps, and eventually their heart doesn't pump well and they're in heart failure.
I'm ready.
Then there's a second group of patients who we call non-ischemic cardiomyopathy, so they don't have heart disease, coronary disease, and these are mostly young people who get a common cold virus and it then attacks their hearts, and they go into heart failure. Some of them go into acute heart failure and come close to dying, and those patients get LVADs pretty quickly. And then there's another group which have just a slow, constant rate of deterioration. Nevertheless, it's the same thing. The patients feel breathless, they can't do anything, they have no energy, they're nauseated, and these patients really need help.
Let's go ahead and have you plug up here.
I had cardiomyopathy, and I was real sick, and I was scared. But when I went in there, it was like he knew exactly how I felt. Everything from how sick I was and everything. And he was like, I promise you, I'm gonna heal you. And I was like, wow. And I felt good ever since then.
Once you're referred to the Advanced Heart Failure Center, whether it's by a cardiologist here already at Piedmont Hospital or a cardiologist way down in South Georgia, you will begin to meet each member of our team, and that consists of a cardiologist, a cardiac surgeon. There are what we call mid-levels, which is another term for a nurse practitioner or a physician's assistant, NPs and PAs. You'll meet an educator, you will meet coordinators, financial coordinators, chaplains, and social workers.
How have things been going at home since you were last here?
They've been going swell.
Good.
You will begin to know these people and get to know these people and spend a significant time with our team members, and we want to get to know you and your caregivers personally.
How are you?
All right.
Once you decide to move forth with one or more of the surgical options, the LVAD or heart transplant, you will then enter what's called the evaluation phase. And to summarize the evaluation phase, it is lots of lab work, different radiology procedures such as CAT scans, chest x-rays. We're going to be testing your lungs for various things.
Tell me about your family.
Doing pretty good.
You'll also in the evaluation phase have a good number of meetings. Those meetings are with each of our team members, and they begin to do an assessment on you and to determine if you are in fact a candidate for LVAD and or heart transplant. The evaluation phase is completed once you have completed all of the testing and all of the meetings.
Heart surgery itself is a wonderful thing in that, we're able to change people's lives and return them back to a state where they can do better. The LVAD is a mechanical device that takes over the pumping function of the left ventricle. It's an assist device so that the heart itself stays in place and actually continues to function. And so what happens is that this is right here is what we call the left ventricle, and this is the right ventricle. And so as you get sick, whether it be from a virus, heart attacks, or whatever, this side starts to get bigger and it starts to double and sometimes even triple in size. And so this chamber doesn't pump. The right side itself tends to work fairly well, and we require it to work in order to feed the device. As the device would sit right here, the right side would then pump the blood through the lungs and it come back to the LVAD, which would then pump it back up into the aorta.
The consideration for advanced surgical options is certainly going to take a significant amount of commitment, dedication, determination, perseverance on your part to get through the surgery, not to mention the lifestyle change that you have thereafter.
You tell me when you need to sit down, okay?
Okay.
Being in the hospital can last approximately 1 month. We have had patients leave here significantly less time, and we've had patients stay here for significantly longer. But on average, our patients are here for the surgery for 4 to 6 weeks. That's the recovery in the hospital time frame. Getting over the surgery itself and the difficult recovery for a lot of our patients, whether you've had heart failure for 10 minutes or 10 years, certainly takes a lot of guts and determination.
Most of these patients are incredibly deconditioned. They haven't been out of bed or they've just been in chairs, and to some, they just really barely are able to actually hold up their own weight. And these are things that someone without heart failure takes for granted. And it really takes the patients a lot of will and determination to start this physical rehab.
Perfect. That's a day's work.
I have had multiple heart problems for 10 years or so or better. I've had 3 or 4 heart attacks. I had a massive heart attack. I couldn't walk from where I'm sitting right now to that chair without being out of breath.
The only option left was to either stay where he was, stay on the medication. The heart was only producing at 10%, and that meant that it wasn't going nowhere but down. So the option to receive the LVAD was given to us, and he decided all on his own. I wouldn't let anybody else help him with that decision because it is his. It's life-changing, and he needs to be able to understand that all by himself.
This found out being much more involved physically as well as mentally than I was. My mind and my body was prepared for, but I've seen what the results of the procedure has done for people, and that's what I want. That's kind of like that I want. Overall, as far as the surgery is involved, I feel good about it. I'm glad that I did do it, and just hope and pray for the best.
To see him walk this morning, this is the first time he's walked outside of this room. That was amazing to me. because I didn't think he'd make it any further than that chair, which was, what, 3 feet? But he did real good, and I'm happy. So you can't help but see the potential of what can be.
Being able to just play with the kids, just to play with my grands. Oh. Take them out every once in a while, and have an opportunity to just share a more wholesome life.
And then we get to be husband and wife doing things we like to do together. We like to dance. We haven't been able to dance in a long time.
The caregivers, it's really hard because they're so used to taking care of their loved ones. We have to actually kind of really cajole them to start going out and living their life again. And so not only does this device and therapy restore new life to the patient, but it gives a second life to the caregiver.
After you're completed the surgery and you're discharged from the hospital, you then enter what's called the follow-up phase or outpatient phase, and it's not over. You're not done with us there. You're still part of our family, and you're coming in for your visits to the Advanced Heart Failure Center. You will not be alone. You will see us once a week, and we may graduate you from that once a week clinic visit. You may be able to come in every 2 weeks, and then we'll graduate you to every 3. We can even graduate you to every 4 weeks.
Hi. All I gotta say is, those are some boots.
It's a big difference. First of all, I can breathe. It used to be when I walk from like here to the door or maybe just here to the wall, I'm out of breath and I'm sweating. And now I can walk, I can smile, I can wear my little heels, and I get along a lot better.
Is there anything stopping you? Yeah.
Our patients really do become part of the family here at Piedmont, and I think that's one of the things that separate us from some of the other programs. We really, despite having a very large program, have everything individualized, and we know the caregivers as well as we know the patients themselves, and really treat it as such a small family business.
This is Wayne. He lives down there with me.
Nice to meet you.
And Robin's had her heart. Yes, he's an LVAD. How long you had yours?
9.5.
9.5 years.
There's support groups that we are going to highly encourage that you get involved in. You'll be receiving newsletters via email from us. In addition to the newsletters and the support groups, there's also Thoratech meet and greets, and that's just a great opportunity for LVAD patients to mingle with our advanced heart failure team as well as the hospital staff. I also provide classes for the caregivers, for your loved ones, anyone that lives in the home with you or anyone that's just really interested and plans to visit a lot and wants to come to the classes about how to take care of you should you need any assistance. They will be very well educated on your device as well.
I'm sure y'all make her feel welcome and it's her first support.
I love the Piedmont team. I love them. It's like, wow, they saved my life. And they make you feel like not just a patient, they make you feel like you family. And they know you by name, and they just make you feel good. They really do.
Thank you. This is even more rewarding because these patients, to some extent, have lost hope, and they've kind of exceeded options of traditional surgery and medical care. And so by putting these pumps in, we've really changed their lives dramatically. And just seeing them and their families doing well and getting cards, and it's incredibly rewarding. And those patients who we bridge to transplant, getting them successfully to transplant is really amazing.
I've seen patients that were not able to eat without getting short of breath. Getting up out of a chair and walking from one room to another was a significant challenge for them. Now they you know, go to grandchildren's baseball games and they're jumping up and yelling for them in the stands, or they're, you know, able to travel, getting back to some of the things that they wanted to do, fulfilling their bucket list, if you will. And they'll tell you, I didn't have to, you know, an extra 15 minutes when I was in heart failure, and now I've gotten an extra 15 months. And that in and of itself, and the change in their quality of life and the extension of their life, to me is enough to tell me that, you know, we're doing the right thing with this program.